Welcome to the COVID Advocacy Exchange. This is our 6th installment of the weekly live Thursday sessions, and we are honored to be with you together today. My name is Dave Fuehrer, and I am with Grit Health. Today's session is about being real and being personal and leaning into some topics that affect all of us, and especially at this moment and things we're going through together. In the few moments before this conversation just started, we were joking, smiling about the level of intensity and even anxiety among all of us as the panelists and the speakers today. And we're going to do our best to let our guards down and to show up and be real with you during this time together. This topic for me is personally very important and something that I've had successes and struggles with during my time as a 2-time cancer survivor. And I thought it would be most appropriate and also meaningful to start with where this all started for me. And I'm honored to welcome in the audience today, my best friend growing up, Jeff, is with us. At 25 years old, when I had my first cancer diagnosis, Jeff had his first multiple sclerosis episode. And for anyone who's experienced a diagnosis or is a caregiver or a loved one to somebody who is, you know how completely interrupting is not the right word, upside down those moments in our lives are, and how we're forced to confront things that we never had a language to confront before. I've spent the last now, I think 17 years, almost 18 years, learning how to find a language and then learning how to connect with others, both to help myself heal and to help others heal, and also to be a part of advocacy to help healthcare heal and be more compassionate. And these panelists and speakers and our moderator today that you're going to get to interact with in just a few moments are really remarkable, and some of the individuals that have helped me profoundly along that journey. Dr. Catherine Benedict, who is our moderator and who will guide us through this session, is a licensed clinical therapist, and she works at Stanford School of Medicine. I've known Catherine almost as long as I've been an advocate. And if I think about those moments where I reached in really deep and started to understand a new layer of how I was affected and what this life after a diagnosis is all about, I think of Catherine in so many of those moments. We also were joking in our prep that I'm known to cry, and Catherine is known to provoke that. She's smiling just off screen now. And so I encourage you, as we lean into this topic today around mental health and well-being for patients going through COVID, I encourage all of us to lean into everything that means. That includes still existing stigma and perceptions around mental health. It includes all of the social injustices and issues we're facing today, inequities in healthcare. It is such a complex and such an important issue that it demands that we lean in wholeheartedly to tackle this together. And so we encourage you, using the chat function at the bottom of your screen, to share comments, write questions, be a part of this conversation with us. Take an active part, and we look forward to your comments and questions as we move into this. We'll ask you comments and questions as we go through this session. And this is more than just a current conversation. This is an ongoing discussion about how we heal ourselves and heal the ones we love now, and actually do more to make healthcare more healing in general. So with that, it is my deep honor to introduce Dr. Catherine Benedict. I'll be in and out as part of the panelists, and Catherine will connect you with them in just a moment. I can only share with you how inspiring and touching our conversations have been putting this panel together. And Lauren and I have had a couple of conversations with people who really reached in and affected us deeply. And so I'm honored for you to have this time together. and Catherine, for you to lead us and guide us through that. Thank you.
Thanks, Dave. That was an amazing introduction, and you're taking me down memory lane, and maybe I'll cry today too. So hello to everybody out there. I'm so honored to be here and to, I don't even consider this leading the discussion, but being able to have this platform for everybody to share their experiences and what they're doing in the world to make it a little bit of a better place during these crazy times. So a little bit about myself. I am a psychologist. As Dave mentioned, I work in the world of cancer survivorship. So I have a clinical practice and I do a lot of research in the domain. And in a lot of ways, I see my job as being the bridge from the patient experience to the medical world. What are all the things that happen outside of that 20-minute doctor visit, right? And you go along with the rest of your life, and how do you do that, and what's the best way? And of course, mental health is, from my perspective, maybe the biggest part of that. The times we live in right now, for multiple reasons, have exaggerated a lot of stresses that we all have. And I'm just excited to kind of dive in and to hear what all of these amazing people have been doing on that front to help themselves, to help their communities, to help their loved ones, and advocate for a better world. So with that, I'd love to kick us off with just introductions going all around. And Jasmin, if you don't mind, I'd love to start with you.
Sure. Good afternoon, everyone. I'm so happy to be here. I'm honored to be here to sit on this panel today. Thank you to everyone who's tuned in. I've been watching the chat. I've seen Morocco. I've seen Ireland, Rochester, New York, all over the place. And of course, my home state of Maryland. Thank you to all my family and friends who are tuned in. I'm here to talk about survivorship and living with MS. I've had MS since, I was diagnosed in 2013, but since then I have reclaimed my life and I'm working full-time. I'm a project manager. I have my master's degree, my MBA, specialized in communications. I have.
Oh no, did we lose you? I'm gonna wait a few seconds to see if Jasmin comes back. Yeah?
Appreciate being here. And I think this discussion is really important. This topic is really important, especially when you have to deal with life after being diagnosed with a debilitating, what couldn't be debilitating chronic disease. So I appreciate you all inviting me, and I'm excited to jump into the conversation.
Thanks, Jasmin. We had you on pause for a little bit, but we caught most of it, and that was, it's great to get to know you a little bit better. Teri, can you introduce yourself? We're so honored to have you.
Thank you, thank you. I'm Teri Brister. I'm the National Director of Research and Quality Assurance at NAMI, the National Alliance on Mental Illness. And I just want to echo, it was such a nice gift to receive the invitation from Dave and Lauren and Dan to be part of this discussion today. It's just an honor to be here. NAMI does a variety of things. We're primarily an advocacy and education organization for individuals and family members affected by mental illness, which covers a lot of territory. And it's a space that affects so many people, and especially when situations are going on like right now. So the opportunity to engage in this conversation with people from a diverse community of different health conditions, because so frequently, most of the time actually, I would not backed up by research, but from Teri's opinion, most of the time it's not just one thing that we're dealing with, it's multiple. By training, I'm a licensed professional counselor, worked in community mental health centers for years. I do have a little bit of a Southern accent. I'm talking to you from Mississippi. I'm a native of Mississippi. Even though I work for the National NAMI organization, I'm able to work from home because the majority of what I did prior to the pandemic was traveling around the country working with our state and affiliate organizations around our education programs. What brought me to this work, and it was quite by accident, I took a psychology class when my first year of college, and my family started making sense. And the more I took, the more I understood. Again, Southern Mississippi, my grandfather, bipolar disorder runs very deep in my family. My grandfather had untreated bipolar disorder. My grandmother and my dad and his sister moved out twice a year when he cycled with his illness. That's just what you did. You lived around it. You didn't address it. You didn't talk about it. I experienced depression myself. Both of my children have depression and anxiety. So I live it. I now teach it. And if I had known 30 years ago entering this field what I know now, I think I would have been a better clinician. So part of what I do is try and help our providers understand what we're all going through. So looking forward to the conversations today.
Thanks, Teri. I'm excited to have your perspective here. Kelly, how about I throw it to you? Will you introduce yourself?
Sure. Hi, everyone. My name is Kelly Davis. I am the Director of Peer Advocacy Supports and Services in the National Office of Mental Health America. MHA is a national mental health advocacy organization. Our national office, we focus on some nationwide programs. We also do public education, like Mental Health Month, and we also do policy, federal and state level policy work. We also have over 200 affiliates and associate members across the country. Many of them provide direct services in their communities. So some of them do kind of local public education events. Some of them do statewide mental health policy work, and many of them provide direct services. So we have a large variety of folks in our network. And I'm really grateful to be here today. I'm a person, I live with bipolar disorder and post-traumatic stress disorder. And I know from my lived experience that mental health is not prioritized. And I know that it's even worse for folks who are only looked at as somebody who's experiencing a physical health concern with no regard for the mental health impact, both in their relationships and how they feel about themselves and all of those complicated things and ways in which we've historically separated those worlds. Even though, as Teri said, there's so much overlap, and many of us, we're complicated people with complex identities, dealing with a lot of different things, especially in the world right now. If you weren't struggling with your mental health before quarantine and fear and all the things that we're collectively experiencing, I think there's very few people who aren't struggling. My work in particular is focused on peer support. And the belief that people with lived experience of different conditions, but mental health, my lens is mental health challenges specifically, are incredibly powerful sources of support for one another. To see somebody and say, the lack of hope a lot of times we feel when we're given a label, to see somebody else who said, I was there, I was scared, and I made it through, and this is how I live my life now, and here's some things I can share with you, is just, I think something that, is beyond words and also backed by research. And lived experience, all of my work really centers. I'm really excited to be here, especially with folks sharing their experience and so many people being open and honest about their experiences, because I believe that letting folks with lived experience lead and have voices and design how we build things for people is how we create a better world.
Kelly, that was amazing, and I couldn't agree with you more. And as a clinician, I just hear again and again how important peer support is, not as an either or, but an and, right? And so support the work you're doing. Okay, last but not least, our international guest, Dominika, can you introduce yourself?
Hello, everyone. Thank you for having me here today. I'm Dominika Czarnota-Szalkowska. I'm Secretary General of Polish MS Society. I'm also a member of Executive Committee of European MS Platform. So today I'm representing both. I'm a psychologist. I'm involved in MS movement over 10 years now. And As you already noticed, I'm not English native speaker, so forgive me my English. I will do my best today.
No, you're amazing. We're honored to have you, and thank you for making the effort. It's an added burden. Okay, so that was amazing. I'm so excited for our talk. And to jump right in, I want to circle back to the top. Jasmin, if you can share a little bit more about your experiences of how living in a crisis, in a pandemic during this time has affected your mental health, and bringing what Kelly mentioned of we are all complex humans. We have multiple identities and roles, as you introduced us to. You're a mom along with all the other things going on. You're working, and that doesn't stop the rest of the things that are happening in terms of feeling at risk, having your network, figuring out how to go on with life. So can you just give us insight into how your world has shifted a little bit during this time and your mental health during that time?
Sure. It's been really tough for me to transition to being home full time with my son. It was when you have work to distract you when you're physically in the office, when you have activities to distract you, taking him to karate, going on, taking him out to different places. Those things are welcome distractions when you're struggling with your own thoughts, right? So being at home full time, it leaves you to quiet. The walls are quiet. Everything is quiet. And so you have nothing but your thoughts, and you're battling with your thoughts. And I have been diagnosed with depression and anxiety, and living with MS and then having COVID hit, my anxiety is like super high. I can't afford to get sick. So I'm hyper focused on washing hands. What am I doing when I'm going out? Who's around me? Who's around my son? No one's allowed in my house, not even my own mom. He's not allowed to go to other people's homes. It's just, I'm so hyper focused on staying as healthy as possible. It gets to me because then I panic if I touched the wrong thing, or did I wash my hands well enough? Those kinds of things I struggle with. And then another thing that's been hard for me, on top of having to deal with work and all that, I've been struggling a lot with grief. I've lost really close family members last year, and the anniversary of my one little cousin who was more like my little brother, he was killed by a drunk driver, hit on his bike. The anniversary was a few days ago. And I lost my great-grandmother, who was the most important woman in my life. I lost her at the end of last year, and I've been grieving hard. And when I'm in the house and I'm stuck, then I'm stuck with all my thoughts and how I feel about that, on top of my aches, my pains that I deal with having MS. And sometimes you try to stay as strong as possible, but sometimes you do say, you know what, I'm really sick of being sick. I'm tired of hurting, my legs hurting. I'm tired of my back killing me. I'm tired of all of this, on top of, I'm tired of being sad, about these things. When does that change? My body can't change. I can't change what's going on in my body. All I can do is manage it. So all of those things just swirl around, and it can keep you and paralyze you in your headspace. So I just think it's important that we do a lot with maintenance of our mental health is super important, which I know we'll probably get to in this discussion. But with all of those deep thoughts, those dark thoughts, those dark times and dark feelings, it has just went rampant during this time for me, and being stuck in the house and not being able to do social activities and going to see people, even if it's just for a moment. So that's where I am currently.
Yeah, thank you for sharing. And so much of what you say feels so real, and it's the real world, where just because added stresses are now being thrown at you doesn't take away the fact that you were already in a process of grieving. You've already had as a baseline, struggling with your physical health and mental health connected to your physical health. And when you were talking about just the constant, the daily worries, the hypervigilance, that quickly spirals to, as you said, panic, anxiety, and that can be floodgates sometimes. So yes, this conversation needs to also include what can we do? What are we doing? Because our normal coping skills are no longer there for us, whether it's distraction, whether it's going outside to get fresh air. In many ways, what we're forced to do, sheltering in place, is the exact opposite of what a therapist would tell you to do, which is get outside, get exercise, right? So I don't want to go on too long, but I'd love to invite the other panelists to both speak from what they're doing as an organization, but also your personal experiences. And I thank you so much for sharing those in your introductions, but also, personal, company-wide. I guess I want to follow up with that is, do those experiences ring true with what you're hearing from your community? And then really the next place to go in the conversation, what I see is, what are we doing? What are the challenges in meeting these new needs and these evolving situations? Does anyone want to jump in, or you want me to call names? Kelly?
So I think, thank you so much, Jasmin, for sharing. I think, so at MHA, we hear a lot from people, right, individually, but I think one of the biggest ways we've been able to really measure how people are doing is we have an online mental health screening program where we have 9 different clinically validated mental health screens. All that means is that it's based on research, and they're the same questions your doctor would ask you about depression and anxiety. And we track data. We've had over 5 million people use them, and we're seeing really intense increases since the pandemic started. We're seeing really intense increases in anxiety, in depression, but even things like psychosis. I think the amount of stress that people are experiencing is exacerbating a lot of things that either were just below the surface or were already there at the prior to the pandemic. What I'll say too, I think collectively there's a lot of grief around like loss of normalcy, loss of structure, all of the things that like Catherine said, a psychologist would tell you, we all have kind of our bag of coping skills, and it's like one day, surprise, there's a pandemic, and also you can't do any of the things that you were doing before, is a scary place to be, right? Like the things that were working, many of us have to kind of reimagine and be creative about what was supporting us and helping us to maintain our well-being before. I would also add, I had 2 separate things that I've heard a lot about. One is particularly for folks who have chronic diseases, is that I've heard a lot of like fear, anxiety, frustration around the folks who are around them, whether that's their family members, whether that's people they work with in their community, who are not taking the social distancing, mask wearing seriously. And the amount of kind of distress that that's caused for them personally, but also stress that that's put on their relationships, and feeling like folks around them aren't willing to be accommodating, even though it's a devastatingly scary time for folks who have compromised immune systems to try to function with all that's happening. And the other thing that I would add is that in our screening data specifically, since the pandemic has started, we've added some additional questions. So we do track things like gender, income, all like voluntary information, and we've added and chronic diseases as well, so we can like go through the data based on people's different lived experiences. But the number one thing, COVID, is about 30% of folks identify that as contributing to their worsened mental health. 50% of people say loneliness and isolation. And I think that is, in addition to worries and fears and like unemployment and all of these different ways that people's lives have changed. For many people, Zoom is awesome, but for many people, Zoom is not cutting it, right? And this, we're social beings. We like crave being in community with other people, and I think there's something really important about also understanding that all of these other things can be happening, but when we're stripped of community, that's incredibly challenging for us as well.
You make really great points, Kelly. And something occurred to me as you were talking in terms of the overlap of that, of both your social network causing stress and then also feeling isolated and alone within that social network. And so I worry about my patients who are living alone, and I worry about my patients who have roommates who don't understand, or who have family members that don't understand and causing stress. And so isolation, sometimes you imagine like a single person on their own, but that can exist in so many different contexts. And how do you handle that? Because we all need connection and support, and in some ways physical touch, and we don't have that. Teri, how about you with the NAMI community?
And as I was listening to you, Kelly, and to you, Jasmine, there's so much to unpack, right? Because there are so many different pieces. So let me talk about NAMI and kind of what we're seeing in terms of a response, and then I want to come back to connect it personally if I can. We operate and love the fact that MHA does that, the PHQ-9, that people are able to do the screening for depression, which is phenomenal. We operate a helpline that's staffed primarily by volunteers, trained volunteers. It's an 8 to 5 helpline, and so it's only during the day. But again, it was people who came into a physical place, a bricks and mortar building, to answer phone calls from people, which had to totally be reworked in terms of how do you do this virtually, how do calls roll over, things that we as a nonprofit had never thought about before. What we've seen, it took about a week to get everything sorted out so that calls were going directly to volunteers and not being dropped, etc. But the calls to our helpline have gone up, if I get it's between 600% and 700% have increased. And many of them are about the typical things you would expect: anxiety, depression, increase in symptoms, but being anxious also about how they communicate with their healthcare providers. I've never done telemedicine. What do? I don't have it yet, Jasmine. I see you clapping your hands. What do I do? How does this work? So we've done some webinars on how do you do it? What is telehealth? What do you need to know? What do you need to know about apps? Everybody's pushing apps and everybody's pushing digital technology, but how do you know what works and what doesn't? So we get those kinds of calls as well. How do I make decisions about this? We get calls from people, and you talked about people who live alone, people who have roommates. A lot of folks with mental health conditions live in residential facilities with a lot of roommates. And how do I know my multiple roommates and the direct care workers that work in the facilities about their hygiene? So just so much. One of the positives that I think is going to come out of this is hopefully it will end up lessening the stigma around mental health conditions for everybody, because I think what it's done is made everybody, to a person, realize we're all vulnerable at any point in time. And when you have, so that's one positive that I hope is going to come out of it. When I think about those of us on this call and the audience that GRIT provides information and resources for, when you have, other than a mental health condition, when you have a chronic health condition that you're dealing with, regardless of what it is, whether it's diabetes, whether it's multiple sclerosis, whether it's cancer, your life is regimented to a degree. You have things that have to be done for you to take care of your physical health. When you also have a mental health condition, those things have to be taken care of as well. When something like this pandemic hits, it rocks your world, because when we hear new normal, normal is a setting on a dryer. What does new normal really mean, and how do we know when we get there? Will we be at the new normal by July the 4th, or will we be there by October? What's the date? And the reality is that none of us know. So we continue to have to reassess on a daily basis. And what we know about depression and anxiety is that the unknown is what can give us the most pause. So let me mention one more thing if I can. We teach something in our education courses at NAMI, and all of our programs are peer-led. You know, programs for people with mental illness are led by individuals with mental illness. Programs for family members are led by family members. But we teach some of the same basic things in all the courses, and one of them is that having a chronic illness, something that's long-term, is a catastrophic stressor in our life. And a catastrophic stressor is something that's unanticipated. You didn't see it coming. You don't have any time to prepare for it. You don't have any previous experience with it, and it has a huge emotional impact. And all the health conditions that have been mentioned by us as we've talked, and mental illnesses, are catastrophic stressors. So is a nationwide international pandemic. And I think it's important for us to all, and one of the things I keep reminding myself is we have to have grace with others, and we have to have grace with ourselves too, because we're really all figuring this out at the same time. Way more than I should have said, Catherine, so thank you for allowing me to babble, but it's, I think that's the important thing of having these type conversations though.
No, Teri, you have me riveted. You can babble forever. I think everything you were saying rings so true. One of the most important things, both for an individual person and for our culture, is to recognize the catastrophic stressors that these recognition as a first step. And I saw something in the sidebar chat that I wanted to add to all of this, just recognizing that it's not just that the interpersonal stressors where we all recognize support is so important, not just stress going one way of loved ones not taking this seriously or feeling isolated, but then feeling guilty that you might need to take different precautions to take care of yourself, and that's okay. But feeling, putting other, that interpersonal back and forth. I thought that was a really important point. Okay, Dominika, can you share, how about the community over there in Poland, and what have you been seeing?
Well, a few months ago when the whole pandemic starts, it was actually, it was a great shock, I guess, for all of us. We just didn't expect it. None of us did ever experience something like that. And we always thought that if it happens in China, it happens in China, it won't happen in Europe. And even if it already Europe, in Italy, everybody thought that, well, it's in Italy. What's wrong with the Italy? But it's not going to came to Poland. So just a few months ago, I think we all thought that this is just one big nightmare or some science fiction movie that is happening out there outside our windows. And at the very beginning, when the pandemic starts, and actually our government acted pretty fast, because we saw what happened in I'm sorry. What happened in Italy. So we locked down basically the whole country pretty fast, and then we all stuck at home. And thank goodness, we as a Polish MS Society, we pretty fast adapt how to work remotely. So we have our helpline that works 5 days a week, and it still works because it's just we use our handies to do that. Sorry, mobile. This is a German word. And so we're working from home, and we also have this remote psychological counseling. We do that since over 10 years at least. So thank goodness, because many people needed and still need psychological support in these difficult times. They are afraid of their health, but also because of economic situation. Many people lost their jobs because of a lockdown. and we can provide this psychological support. So actually, and we learn how to do the webinars, and what I already mentioned when we were talking 2 days ago, we did 2 webinars on MS and COVID-19, because we wanted to provide as much information as possible, as quickly as possible. And there were plenty of people taking part in the webinars. We also thought that this is crucial to provide the reliable information to people. So we asked our advisory board to do that, our medical advisory board, to prepare guidelines for patients so they were not so lost, and so they will also feel some kind of reassuring emotions.
Yeah, thank you. So it sounds like across the board, well, we're doing what we have available to us, right? We're all turning to technology to try and pivot and continue to provide support and to continue to reach those who need help and support them in that access. For me personally, our hospital switched as many visits as possible to telehealth. I see my patients over telehealth now, but there are a lot of conversations among clinicians of, is this okay? Is it still beneficial? Are patients still feeling like this is helpful? What works, what doesn't work? And I wonder if, I don't want to, anybody jump in if they have something to say, but both on a personal level, if anybody has participated in telehealth specifically around mental health counseling, or I hear from you guys in terms of your different organizations doing those webinars, doing those programs. Are you hearing if they're working, or what's the challenge there? What's the positive? I see some pros and cons to it.
I'll speak up. I hate it. I see my therapist every single week. I will scream to the rooftop to anyone who's struggling with their mental health and having different feelings, whether happy or sad, to share them and work through them with a mental health professional. I see him each and every week via telehealth, but yet I still miss going into his office and curling up on the couch with his big fluffy blanket that he keeps for me in there because it's always cold, and just having that face-to-face conversation, because it feels warmer, it feels more comfortable and more personal when I am actually in his office. And so having to transition to telehealth, while helpful, I'm glad that I do still have access to him to be able to work through my my issues and have someone to talk to as an outlet who can help me professionally. I still do miss the personable feel of being in the office and having that interaction. Like my love language is touch. So being in the presence of people feeds me. It feeds my spirit. So I believe you when you said sometimes Zoom does not cut it. I know Kelly said that. Sometimes Zoom does not cut it. And when I'm sitting in here and I'm crying because I'm thinking about my father who I lost 2 years ago, or thinking about my granny or something like that, sometimes I need a hug, or sometimes I need someone to just hold my hand. And with that not being available, I can't get in to see my therapist in person. My love language is not there. So my spirit isn't being filled in a way that I really, really need it to be filled. And a lot of people are struggling with that. And I've talked to some of my other buddies in the MS community who miss going to their therapist as well. They're just like, I just don't like this telehealth thing. I don't feel like this, is helping me. I'm talking to a computer screen versus a person. Because when I'm looking at you all, it could feel like I'm just watching TV, right? Not actually talking to a physical person. Like I'm just watching a movie or something versus it feeling real. So I know a lot of people are struggling with that. And with me, with my love language, I'm struggling, to get through it. Although, like you said, Catherine, it does have its pros and its cons. I'm happy I still have access to it. I just miss life being able to be in person with someone, and being able to have that ability to feel the warmth of his office, because that's one of the reasons that you can get comfortable with a therapist, is how you feel, that homey feel, to be able to express yourself openly and feel comfortable in that environment.
Yeah, Jasmine, I totally agree. And my love language is touch as well. But I think there's something so true of what you're saying. When you go to a place, whether it's every week or every 2 weeks, that's a safe space, and you enter a different zone, right? That's how we work. That's how our brain works. And then on top of that, the physical touch and the energy in the room of when you're with a person that you trust, that you feel safe with, or in your outside life that you love. And if I were to just reframe this for a second and flip it on the head, how beautiful is it that we can't so easily replace human connection with a computer, right? Like, thank God. Human connection is special, but then that doesn't help where we are right now. What do the others think about that? Does anyone else have personal experience with like telehealth services, or how's it going in your org?
Just a couple of things, and Jasmine, I so identify with what you're saying. I haven't had the personal experience of participating in telehealth. My husband's a psychiatrist. I've watched this from a different perspective. He's and you can tell by looking at me, my generation. He's a little bit older than I am and has avoided telemedicine. We're in Mississippi. It's a real thing. There are a lot of rural areas, but he's felt very strongly that it wasn't possible to make those personal connections. So he's just avoided doing it. He also has a tremendous hearing impairment, so relies very much on being able to sit closely to the person he's talking to and read their body cues. So I've watched him working remotely during this time come to accept it. He no longer refers to it as a necessary evil, but I think it's something that it's a wonderful tool to have access to. I agree with you, Catherine. It's so reassuring to know that the human touch and connection can never be replaced. But I've heard so many people, because he has his computer going so loudly in the other room, tell him that they were so grateful that they were able to connect at all. It's nice to have some connection, even though, but also looking forward to, when are we going to be open again? When can we see each other in person again? The other thing I want to say, remembering that this is an advocacy call, is, and I have something stuck to the bottom of my computer, how do we put the genie back in the bottle? I actually heard another psychiatrist say that one day. What's going to happen when things settle back down? Are providers going to move to, well, telehealth is just as good, we don't need as much personal contact? So that's something I'm always mindful of, is I don't want the system, if you will, to take it for granted that this can work as well as face-to-face. So we don't, I'm trying not to be Debbie Downer, but I just want us to be aware as we do get back into situation as usual, that we have those options. It's a wonderful option, but it's not as good when it's all you have to rely on, if you will.
Hey, I wanted to jump in and say this. I was watching the chat, and a few people said a few things that touched me or hit home for me. One person said they're introvert and they're thriving in this environment, right? So I like people when I like people. And I don't like people when I don't like people. So sometimes I am a person who's just like, I don't feel like being around people. I just want to be in my house. And my mom gets on me. She's like, you and your son really love your house. I love being home. I prayed for this rest from the hustle and bustle of my everyday, my commute and all that. I didn't pray for the pandemic. They could have kept that. But I asked for this rest. It's just the struggle sometimes that I mentioned before. So sometimes my introvert side is in effect, and I just want to be in my bed and watching movies and watching TV when my brain is quiet. but there are other times that I do struggle. And then another person said, I think it was Jeffrey. Jeffrey was talking about how, as a person with MS, using telemedicine for his neurology appointment, right? So it's not, for us, it's not just about our mental health, it's our physical health as well. So I had my first neuro appointment via telemedicine, and I was talking to my family and friends like, how in the heck am I supposed to have my neuro appointment as a checkup via camera? You can't, how do you check my balance and my strength on a camera, right? So then that makes me uncomfortable as well, because I'm like, how can you really tell what my current state is physically from a camera? So although she had me get up and walk across the floor in front of the camera and do certain things to follow her fingers and stuff via the camera, I'm still uncomfortable with that, because I'm like, okay, but you still couldn't check my reflexes. You still couldn't push down on my arms to check my strength. And what if the camera is distorted and you're seeing me wrong? You know, those kinds of things, especially with a person with MS who has to do those things to maintain, it's difficult via telemedicine. So again, the pros and the cons of being online with telehealth, but also the pros and the cons of the social aspect being taken away. You know, I do enjoy the rest, especially with a person with MS, and my major struggle with my MS is my fatigue. I get super tired, and sometimes like I need to just lay down or stop what I'm doing and sit down and take a rest. So that part is great. The commuting and all that is taken away, but what are we giving up? You know, for what is the detriment of me being at home and resting? You know, what am I giving up to be able to do that? And I've learned, I don't even necessarily know if the phrase the hard way, learn the hard way, but I've learned just what being at home and resting costs me, mentally, especially.
Yeah, absolutely. And I think what we're circling around a lot is we always want options. I saw on the side panel, I was thinking the word options in the side panel, they're talking a lot about choices. And so hope, you know, I want us to talk about what we think the future is going to hold, and hope, and I assume, you know, what we want is being able to have choice and be flexible with choosing the pros without the cons, and for the different situations, and having individualized care. So I want to be headed in that direction for the conversation, but more about right now when we don't have choice. And not only do we not have choice, but there's uncertainty of how long this might last. And humans don't like uncertainty. I don't, nobody does, right? And that's really challenging. I didn't want to continue on without having like Kelly or Dominika to have a chance to jump in if anything's been coming up for you with these conversations.
Yeah, I can add a little bit. So I have gone to virtual therapy as well. I think a lot of what you know I've experienced and what we've heard from people is that it's convenient, is that it just cuts out a lot of travel time, or like, you know, if you take care, if you're like a caretaker for other people, like, you know, it gives you a lot of time back. But I would say a major thing that has come up, particularly for teens, or for folks in unsafe living environments, or just for anybody, is privacy. Mm-hmm. Like I live by myself. I don't know that I would be comfortable having an honest conversation with my therapist if I lived in a 1-bedroom apartment with somebody else, or even if I lived in a house with somebody else. Is that, you know, I don't want my kids to hear, I don't want my, you know, significant other to hear. And I think that that's really challenging, because, you know, some people are comfortable, even there's like text-based therapy now. But I think many of us want to communicate verbally, and, you know, therapy is supposed to be this safe space for you to say whatever you want to, whatever's happening. And in addition to like the, you know, in-person loss, I think many people feel like they've lost the ability to fully express how they're doing in those sessions. But what I will say too, in terms of resources that we've provided, is that I think a lot of people, well, I guess there's 2 points. So one is that a lot of people are moving to kind of do more like self-help learning in addition to kind of like one-on-one therapy. So we do webinars. Since the pandemic started, we've been doing twice a week webinars, and it like so many people were looking for like direction support that it like broke our software. So we had to start maxing out at 2,000 people per webinar. We reached like 20,000 people in the first month because so many people were desperate. And it's really interesting for us because, you know, as MHA, our audience is people with lived experience, but it's also people who work in mental health. And many of our webinars are how to do this program, like the benefits of this. And the really popular webinars were like, I taught one on building self-compassion, or like connecting with other people. Like people were just so desperate for information, and you know, for a space, even if they're not talking, of like hearing other people talk, of chatting in the chat box, kind of like what we're doing right now, right? It's just authentic conversations. And to Teri's point earlier, I think, you know, we've seen in those spaces and in general this like reduction in stigma, because most of the comments I would see before, right, are like, this helped my client, like this is a really good idea, all those things. And now it's like, I'm having a hard time. I as a person who's like a clinician, who has my clinician hat on, and my, you know, I don't necessarily like speak openly about my personal experience in these settings. Everybody really, you know, in interactions, but in those spaces are really, you know, openly sharing like this is a really hard time. And I think there's some degree of maybe like shared humanity and connection that people feel from that.
I think you're absolutely right. And Kelly, I was actually poking around your website and wanted to ask you about all those webinars. It's amazing to hear you've had that reach. And just looking at their titles, they look so helpful, and others should go to your website. What other programs? So that answers my question, that those in some, you know, we have limitations in today's world with how we can reach out to provide support, how people can access support, but we're trying to do the best we can. How else have people found what's working, and what indicates that? Are we meeting the needs of what our communities need right now? Dominika, please.
Yeah, I just wanted to mention something that EMSP, so European MS Platform, do. They have this initiative called MS and COVID-19 Squad. And this is based on the idea of peer-to-peer support. They have this, every Friday they host a digital coffee table on different topics. Tomorrow is, the topic for tomorrow is work. And it's also a way of people with MS helping each other and supporting each other and exchanging their experience. The group is mostly focused on young people, so there's not such a language barrier, because obviously we speak so many languages in Europe. That might be a barrier, but I think that this is also a great idea, and maybe we as a Polish MS Society, we also should implement something like that to add to our program of support.
That's great. That's really great. And Teri, I know you mentioned a lot of webinars also in terms of how do you do that? One, how do you do this work? I think you mentioned, and then also for the community, for those out there. What have you found?
It happened organically. I wish I could say this was a great strategic epiphany, but it was more like a panic, because we're similar to MHA in that we have a national organization, there are state organizations, and there are affiliates or local chapters. And in the first few weeks of shutdown or sheltering in place, we had affiliates reaching out to us and saying, what do we do? We had to cancel our walk. We can't raise money. We can't pay the light bill. How do we keep our organization going? So we held a virtual town hall for NAMI leaders, and then thought we need to do something like this, kind of the way these calls got set up, right? You started holding them weekly. So we've typically done a NAMI Ask the Expert webinar where we have a leading expert in something come in once a quarter and do a presentation that's open to the general public, and then there are questions and answers moderated at the end. Beginning the middle of March, we started doing those every other week. And the topics have changed. They started out mental health and the workplace, the COVID-19 in the workplace. What do you expect? We did the one on apps and telehealth. The one tomorrow is on race and trauma, because as we all know, these other situations have escalated during all of this time as well. The one last week was on LGBTQ and youth mental health. We have Alpha Stewart coming in a couple of weeks doing one on mental health disparities in different cultures. So the topics have varied, and I can type the link in there as well shortly, but we do the same thing. We record them and post them for people. We didn't crash our platform, Kelly. It just didn't work. So we had to get a bigger one. Literally had to shapeshift and move to WebEx so we could accommodate 3,000 callers. So we've gone from participation of 150 to 300 to participation is never below 1,000. I saw somebody typing in the chat that it's been wonderful to have access to the additional information and so many things that people are doing free. We'll give a quick plug. NAMI's convention is going to be virtual this time for the first time ever, and we're doing it free of charge. And it's going to be happening in a couple of weeks, and about half the people who've registered so far have never been to a NAMI convention before. So again, I think we have an opportunity to reach people because number one, they're out there looking for things, and number two, there are so many different entities who have shape-shifted, like you've heard today on the call, and are trying to figure out what can we do. So is it enough, Catherine? I don't know that it's ever enough. But it's continuing to figure out how do we meet people where they are.
Yeah, thank you, Teri. Absolutely. And then, so I wanted to jump in because I saw on your website, is that the NamiCon that now will be?
Yes. Yes.
Yeah, I saw that. That looks awesome. That looks great. So there's two topics that have come up that I'm really happy have come up. Three, depending on how you define them. One is this idea around reducing stigma, and hopefully that lasts moving forward. And then health disparities, and closely related to that, racial inequality, right? And so I think one of the more traditional perspectives of telehealth is that we can start addressing some of those health disparities because you can reach populations you may not have otherwise. It's a lower cost. Well, sometimes not. But what are some intentional thoughts around either one of those topics? We can jump in. Those are really big topics, but looking to the future and looking to some steps we're taking now that should last into the long term, when hopefully, I don't know if we want to say life goes back to normal, whatever normal might be, but looking at the long run. What are this is certainly a critical moment in time, right? That's a big ask for people to kind of wrap their heads around. Let's take stigma to start. How might this change? Kelly, I think you mentioned there's a certain level of humanity in this that we're all struggling. Do you guys have thoughts on whether this will have lasting change on stigma related to mental health, and particularly the overlap between mental health and chronic disease?
I'll start with this one. So I'm hoping that this will have lasting effects on lessening the stigma around both having a chronic illness or any kind of illness, disability, what have you, and the mental health field. I'm hoping particularly that this hits more home in the workplaces, because there are so many workplaces who are not sensitive to people who may have a chronic illness or have struggles with mental health. Sometimes you might need to take 5 minutes and go in a closet and let a cry out or something and then go back to work. I know with me, I am blessed with my job that we have a health suite, and sometimes if I'm struggling with fatigue and I feel like I'm about to just seriously pass out, I'm able to go to the health suite and I can go lay down and take a 30-minute nap. Because I have that accommodation. But I have had, unfortunately, a really bad experience with the stigma of having a disability in the workplace. And at one of my old employers, I actually lost my job. after coming back to work, being in the hospital for months when I had my first exacerbation with MS. And when I came back to work, I had a different supervisor than I did when I left, when I got sick. And she wasn't sensitive at all to my disability. In fact, she held it against me. And she was just making it hard for me to keep up because my brain couldn't keep up. I'm trying to get myself back on track. I'm trying to get myself back there, but she was making it really hard for me, and she did it on purpose. But the part of my brain that was still working was the part that said document everything and keep track of everything. And after I lost my job, I actually fought it, and I went back through the union, and I did fight it, and I had the emails, I had the conversations documented, and I was able to get reinstated at my job. I didn't want to go back to that organization. It was for state government, but I did go to a new state government organization. But that was a part of me, or that experience put me back in the headspace where I was feeling when I first got diagnosed, in that I was ashamed to have MS. I did not want to tell anyone. I did not want anyone to look at me differently. I did not want it to be held against me like it ended up doing at that job. And so I kept it to myself. And from then on, when I went to other jobs, I didn't tell anyone that I had MS, because I don't want anyone to use it against me or to think differently of me and my abilities. I want to just be known for being Jasmin, the girl who gets it done. I don't want to be known for, oh, she made a mistake, she forgot that one thing. It's probably because she has that MS. You know, I don't want that to be attached to me. And we talked about earlier those labels and that stigma following us, but that stigma and the way that people, and especially in workplaces, perceive these issues, it does put a great deal of shame and guilt in ourselves. And I do beat myself up sometimes in the workplace. If I'm not on my top game and being a project manager, just imagine how organized I have to be all the time. And sometimes my brain is just not working, and I'm not able to keep up, and I'm upset about it. I'm beating myself up like I'm having a hard time with this project. I can't keep up. It's not going the way that I'm supposed to. But I can't tell anybody though, because then they'll look at me differently, or they'll say, well, you're not able to keep up, we're going to take you off of these projects, you know. And they're not understanding that I'm just having a bad day or a bad week and I can turn it around. They just see that label and they put that stigma on me. And so I'm hoping that during this time, I said all that to say, I hope that during this time that places are more sensitive to people who have underlying health conditions, which I've seen some changes, especially in workplaces. They're like, you know, we understand we have people who have underlying health conditions. These are the accommodations we're making for them. And I've seen that in my workplace. But also, I think people will be more sensitive, and I hope that they're more sensitive to the mental health aspect of it and how much people do struggle. And people who are struggling with mental health issues, this is just now probably revealing to them that they have mental health issues. They didn't know, you know, or they were ignoring it for so long, and it just said boom, and their minds got blown, you know, when COVID hit. And now they are in a space where they're just like, I have to figure this out because this is not working for me. Because they're forced into that pinhole of the four walls of their homes. So I'm hoping that this does change the journey for a lot of people, and people won't have the experiences that I've had, especially when it comes to the workplace, school. I've had people, when I'm out and doing MS ambassadorship, talk to me about how their schools, their university, their professors aren't giving them any slack, even though they know they have a disability. Well, if you can't keep up, hey, what am I supposed to do? You shouldn't be here, you know. And it's unfortunate. It's unfortunate, but I'm hoping that during this time and them seeing just how many changes people have to go through, that this will allow them to be more sensitive to and build in accommodations for those people who have physical and mental health issues.
Jasmin, thank you for sharing your experience. Those are really powerful stories, and what speaks to me almost as the most powerful piece is how that can quickly become internalized, and not that it's a clear-cut thing where you can feel the need that something might not be fair and you need to self-advocate while at the same time feeling disappointed or mad at yourself, you know, and it's just complicated stuff. I want to bring Dave back into this conversation because I know he has thoughts around this and he's gone through his own journey.
Yeah, thank you, Catherine. Jasmin, you mentioned shame just now in your comments, and that's such a huge thing for me. On March 1st this year, I ran a marathon, and I trained all last year to run the first marathon of my life. And I did it, I finished, you know, and I never thought that was something I would ever accomplish in my life. And then that was the week before COVID really got intense. And since that first week of March, I've gained 21 pounds and haven't run really at all. And in my head, I keep feeling over and over, you know, I just wasted all that. Why am I letting myself get back into these bad habits? And then that spirals into other areas, you know, and I'm working nonstop because I don't want anything to slip. And like these things just keep compounding themselves. And I heard you say shame, and like I went, oh my God, you know, that's how I feel. That like I felt like I pushed myself to get to a place, and then I slipped right back to things that I've been struggling with. And I asked Catherine if I could share that because the hardest thing for me is not comparing myself to other people. You know, like when I start feeling like that, then I'm like, well, my friend Jeff has to wear knee braces to be able to walk. And, you know, Jasmin had to relearn how to walk after, you know, she started. And I get into this loop of like, well, but it's not as bad as others are dealing with, so I shouldn't feel bad about it. And it is just a tough place to get out of. So I just wanted to share how much those comments are like that loop in my head of not being kind enough to myself, maybe.
Dave, it's interesting. You when I thought you said compare yourself to others, I thought you were gonna choose sort of upward comparisons of healthier people can you know, can do this so much, or I don't deserve to struggle because other people have it worse. And those comparisons can go in both directions, and it's so hard. And I actually I really am I want to throw this to Kelly, because in these moments, sometimes peer support is or we think of peer support as those shared experiences. Sometimes it can go wrong if you compare in the wrong direction, but how do you navigate those?
I would say, I mean, I think it's hard because it comes down to the person receiving support. Because I do think that we can, when we hear stories of people's well-being, we can be inspired, but we can also think, you know, I'll never get there. And I think too, you know, in the, you know, I'm sober, in the addiction recovery space, there's a big war stories environment, right? So there's like people saying, you know, look at all of the things that I did that were really bad, and like maybe you don't really have, you know, issues. And I think that can make people question, you know, their experience too. So I do think that it goes both ways. I think, you know, with what I would recommend is this self-compassion approach, which is just like not about comparison. It's just like life is hard for everybody. I'm allowed to suffer, and it's not like a race, or there's no award for the most or least suffering person, right? It's just like we're all human, and we're all having this kind of experience, and we all have difficulties in different ways. And I think too, like objectively, right, you know, I can look at somebody and say, I can't imagine, that person has like such a hard life and such a hard experience. And they might be like, no, like I'm having a good time, like I'm chilling, like, and then in the opposite direction too, of like, oh, this person looks like they have the perfect life, and they might be in serious distress. So I think part of it comes down to like assumptions that we have about other people, and like their external life or circumstances like mirror their internal ones, which aren't always necessarily true. But I think it's also the self-compassion piece of, you know, I'm connected to people. Nobody's better or worse than anybody else, and we all experience suffering in different ways.
Yeah, that's a really important message. And when you say this battle mentality or battle culture, we see that in the cancer world also. And there's so much war talk of, you know, I battled this, I survived this, I beat this. And it's just, there's not softness around those words, and self-compassion is a big word, a big term. Teri, Dominika, do you guys have thoughts on this?
Yeah, actually, I wanted to share an example with you. I had this conversation today with a brilliant young woman that has MS since 10 years. We met 10 years ago, and she was helping me with the project to become mom with MS. And because she's a graphic designer now, she's helping us with other project. And we were talking about admitting that you have MS in the workplace. And she told us the story that she decided to tell her employer that she has MS. And that wasn't the easiest decision, because once you tell that, you can't, take it back, because obviously it's a chronic disease. They will now always know you have MS. And what Jasmin said, they might blame you that you didn't succeed in your work because of your illness. And she said that so she decided to say she has MS, and the woman, their reaction was, because the boss was a woman, she said, "Oh, I know one woman with MS, and her kid has a cancer, So she said she didn't know how to react. What should I now feel? I don't know, better because there's this other woman who not only have MS but also kid with cancer, or should I be afraid that my kid gonna have cancer?" And we were talking that this is actually cultural. So they always, except at least in Poland, they will always show you that it's even if you are suffering, there's someone else who suffers more. So feel guilty because of your suffering, and that you're supposed to be brave. And again, this war language, like you need to fight and be brave, and no tears, no feeling guilty.
Yeah, that's supposed to be anything, right? But supposed to be brave. Teri, you look like you want to say something.
And well, so many things, because I think I want to say one thing and then I read the chat and I want to say something else. So to try to drill it down, which you've noticed already I have trouble doing. Just going back to Kelly's original comments about peer support, and it's so critical. And there's always, it doesn't matter what room you walk into or what the topic or the condition area is, there's always somebody who's got it worse. There's always somebody who's at a better place. And I think we learn from both of those groups. I mean, when I teach, when I facilitate, I get as much out of it as the people that are in the room. And it struck me when, and I think it was something that Kelly said, it struck me that in mental illness specifically, and I see several people in the chat, I was concerned I didn't have MS enough. I didn't have a bad enough case. The term serious mental illness, it's a battle in the space. Well, who are you to say that mine is serious and yours is not? It's so that guilt and shame, Dave, you are so absolutely right. I don't want to talk about my depression. I've never had to be hospitalized. So mine's not as bad maybe as yours is. So it really is about giving ourselves grace too, and helping emulate that for others, if you will. And part of that is just talking about it. And just one other thing quickly that I want to say that I think related to this, but also to your question, Catherine, about the workplace and several things that we've said about the work. We've had so many people contact us and say, we want to have something for our staff because they're on about returning to work and fear. Great. You want a presentation on anxiety and depression? No, we don't want that. We want you to talk about fear. So I think we have a unique opportunity as advocates to educate the general population, if you will, that we're really all talking about the same thing. And at the end of the day, we're all human beings. So I'm so happy to be in this room today with all of you. and all that you're doing and what you represent.
Yeah, thank you, Teri. That's an interesting, you know, I started off this little part of the conversation thinking, you know, we're dealing with the present moment, but also planning for the future, and planning for the future as individuals, with our own complex histories, and as leaders in this space. So in our last, say, 15 minutes, 10, 15 minutes, I'm not sure when I'm supposed to wrap up. What do we need to be thinking about? Thinking that this is a room full of humans, full of leaders that are in this space, trying to do good work, trying to make the world a better place. What are the lasting comments? Dave, I'm going to throw this to you because you kicked us off. You're our fearless leader at Grit. You put us all together. What was your vision? How this is, I know this is your passion and something you live and breathe, so you have something to say.
Way to catch me off guard. Normally I have 3 seconds to form my thoughts, and so I'll take 3 seconds to form my thoughts. I feel like real conversations and connection are more important than ever. And not only because of all the physical distancing and challenges that we're facing, but like all the added intensity and pressure and everything that patients with, you know, chronic disease or acute disease, whatever we're each facing, like all that has just gotten wrapped into this really, really tight center of things that we're dealing with. And I know that as somebody who hid what I was going through, including my mental health challenges for almost 8 years, these moments to come together are life-changing. And when I see someone finding their voice and just being able to find words to express what it's like inside, it almost like lets it out. It makes it not as bad, right? And just being able to let these things out and hear others say, yeah, I understand, and this is what I'm going through too. It just makes us all human, and it makes the world feel more kind. And so if I had one hope or one vision for this conversation, it's that it's a moment to feel kind for ourselves and towards others.
Yeah, I'm sorry about that, only 3 seconds, but that was beautiful. And I think correct me if I'm wrong, part of what you're saying, part of what a lot of us are saying it's connected to the stigma. It's trying to move in a direction where there is more space to be yourself, to find voice. And part of that, and that's connected to feeling free to be kind to yourself, right? Because without the outside world stigma, there's more freedom in that to feel okay with wherever you are in this day, in this month, in this year. In terms of looking to the future, I'd love to hear all of your thoughts on, in general, just where your organization is headed, what you're thinking about in terms of the future, but then also circling back to this idea of health disparities and mental health and people with mental illness have always been an underserved community. And now it's never more pressing than today, how even within that group, there are inequalities in access, inequalities in experiences in the world we live in. So with that prompt in mind, thinking about the future and being intentional about some of the issues that are really coming up now more than ever.
I can share a little bit. So I think, I think maybe many folks on this call will identify with this idea of never let a crisis go to waste. As somebody who's had a lot of mental health crises, I've learned to kind of reframe and to some degree, like this post-traumatic growth, what do we learn? Like about our values, how do we reflect on our values during this time? And I think for all of us, there's this like resounding message of there's no health without mental health. Because we're experiencing collective, like widespread trauma. And I think that the empathy that comes from like deep suffering in yourself and then seeing the suffering of others, I think can really help us kind of, as a nation, as communities, like come together and say, oh, this is important. And, not to, be the bearer of bad news, but the data is predicting that the real mental health impacts of this crisis are probably, we're not seeing them yet. There's a lot of predictive data around like increases in deaths of despair, so suicide deaths. I think we haven't talked about the job loss, the economic impact of this, both in the short and long term. And I think having all of us seeing this, like how quickly our lives can be turned upside down, and maybe the wrong emphasis and values we've had about what we want as a society, about who's important and about what parts of our lives are important, can really help guide us and bring more people in terms of making sure we have more access to traditional mental health resources, whether or not you have a job, whether or not everybody's deserving. But then in addition to that, our communities can hold one another with more compassion, because we're going to really witness each other in a way that maybe we openly haven't witnessed each other before.
Yeah, Kelly, that was really profound. And I just want to hit home the point, the idea of post-traumatic growth. Sometimes it feels like a technical term, but I know exactly what you mean. And the idea that you can grow and learn from an experience at the same time that you're feeling stressed and hit down by, you can have post-traumatic growth at the same time that there's post-traumatic stress, and both of those things can be true at the same time. And how do we come through it, and how do we continue to find health and find support when we need it? And then coming back to your point of being within a shared community and reaching out to others, you may not understand their experience, but reaching out with kindness and compassion.
On that, Catherine, I would say that where we go from here, or the prayer that I have is that, as Kelly mentioned, we have those traditional mental health services and ways of reaching out, but I think there's a profound need, especially during today, of having specialized mental health services, especially to those who are even more underserved than the underserved. So what I mean by that is, like in my community, in the Black community, there is typically a stigma attached to going to see a mental health professional. I don't need that. I don't want to tell them my business. There's nothing wrong. We deal with it internally. What goes on in this house stays in this house. It's that kind of idea. And then tack on all of the stressors of our lives in general and what we're dealing with on our regular stuff that we deal with. Today, we're now dealing with stuff that we've been dealing with since the beginning of our time, and that's the problem with racial injustice and all the things that are going on around our country today, and that's been going on in history, and that we feel like no one's paid attention to, but it's had such a traumatic effect on us and the way we operate in our everyday lives. And we need professionals who are willing to reach out and touch and have the heart and the courage to deal with these issues and to attack these issues with these individuals like me, because we have mental health professionals, we have regular professionals who are scared to touch that. I'm scared. So how are you supposed to, or how am I supposed to deal with it if you're scared to help me deal with it? You're scared to touch those subjects and help me move through it. So I say that to say that there's a gap there, and there's a huge, well, not even a gap, there's a big crater there that needs to be filled, and we need brave professionals who are willing to go there and to help us attack those feelings and work through those feelings and help us figure out how to better serve ourselves in today's society.
Jasmin, you're absolutely right. Thank you so much for bringing your perspective and bringing those issues up. And two thoughts on that. One, how there may be a stigma or hesitance in the Black community, and that is very well deserved, right? From how the health system has treated the Black community historically and to today, and who has access and how they're treated within the system. And just to highlight the point that it is our job to reach out and to, I don't even consider it brave, I consider it a professional responsibility or human responsibility, right? To reach out, to get the training that I need if I feel like I'm not equipped, and to be the one making that first step and that outreach and that effort, because that's what we do. That's what should be done, right? So that's a longer conversation we should be having as well. Teri, I know you're a leader in this space. You're in Mississippi. These are issues that must be coming up for you, and you must have lots and lots of thoughts, but if you can whittle them down for us. I'm excited.
Yeah, there's always the challenge, Catherine. It's the whittling down.
Well, let me just pause because I admit that I don't have any experience living in the South. Mississippi is a very different place than where I am in the LA area right now. You know, let me just back up for 1 second. We talk about the importance of patient-centered care, but I think that term gets thrown around a lot, and it's not just one patient experience, right? That's not what that term means. Patient-centered care is with an individual, within a context, within a subculture, within a larger culture, right? So just all that is to say, I have no idea what the culture is like in Mississippi, and you're dealing with your things. But anyway, your thoughts.
And as you said earlier about something else, that's a whole nother conversation and a whole nother webinar. I will tell you there are progressive people in Mississippi more than there used to be, but it's the struggle is real. That's just a good way to put it. To try to be succinct, because literally I was trying to figure out how to be succinct. So many things, but about where we are going forward. We don't have a true healthcare system in this country. We definitely don't have a mental health system in this country. It's very much still a function of where you live and where you are. And then even drilling down below that, it's how much money do you have? Do you have insurance? So the social inequities and the racial inequities are there. What COVID-19 has done is put a magnifying glass on what works and what doesn't work in our country. And it's identified the craters, as Jasmin said, and you have a way with words, woman, because you nailed it. They're craters. So if we can't lose this crisis, as Kelly said, not forget what we're learning right now, which is at the end of the day, we are all just human beings. And it's important to put one foot in front of the other every day. Dave started out asking how stressed we were feeling when we were prepping. I couldn't even think about that. Just putting a number to it stresses me out because there's so much. And I literally have to focus on what's the biggest fire right now and what can I do to negate that fire and then move on. So I would hope we'd leave this today with that we don't give up. We all have so much to offer. And there is potential and there's energy right now. We just can't let people lose the energy and the focus.
Yeah, Teri, it was such a great point. And I really feel like we've all integrated here because I want to talk about the craters that Jasmin brought up, the never let a crisis go to waste, Kelly, I think you said, which I hadn't heard, which is true. Dominika, we missed you a little bit, and maybe some of these things are more US centric. But I know that well, I don't know anything, but I imagine there are parallel or similar situations, and just in terms of meeting people with the individual needs that they're coming to, that we're charged with trying to meet. In the last few minutes, well, Dominika, I'm sorry, did you want to close with anything?
Yeah, I just wanted to say that I'm actually positively impressed by the comments on the chat because they are all so positive. So you know, I'm happy that we are among people who are so positive, and I think this is really very, very important to be tolerant, to be positive, to be good for one another, and as for America, like for Europe, and well, in Poland we are very homogenic. So, but in Europe generally we are very divided. So, if we're doing webinars like that, we need to obviously think about all the cultural differences to fit all the needs, and I think this is really important. So we are very different from one another. We have different needs, and we need to remember about that. So
yeah, absolutely. Thank you. And it's so true. And in some ways, there are shared similarities of the human experience, and in other ways recognizing the individuality, right, and finding that balance. So Dave, how do we do? We're at the closing of it. Take us home.
Boy, if there was ever a moment that I felt the enormity to honor and respect the comments, it is this moment. I just want to thank everyone for how genuine and real your comments were in the audience and the panelists. Catherine, thank you so much for guiding it and creating it that way. I know that I've, in my life, felt the pressure to put on a good face or to compartmentalize things. You know, when I'm being treated for physical symptoms, I almost don't allow myself to feel how much that impacts my mental health. And I just thought that everyone today in their comments brought that together in a way that's human, right? Because as humans, we don't get to separate that. And your comments really made me feel human. And I forget who wrote it in the text, but someone said it validates us. And I feel more validated for everything that I've gone through. And I hope everyone in our audience and all of the panelists do. It was such an honor to do this together. If this was meaningful and helpful, we would love for you to help spread the word about this advocacy exchange. So this panel that we're just finishing now will be back up on the site by Monday, if not sooner. And so, the question is always, how do you let somebody who's looking for help know what kind of help is available? And this conversation is something that I wish I had at the beginning of my journey. So please share information about it. All of this is at the covidadvocacyexchange.com. And we've done 6 sessions now. This was the 6th. We've got 4 more that we have scheduled coming up. So next Thursday, July 2nd, we'll be focusing on practical solutions for patients during COVID. And that is a combination of advocacy groups that are creating resources, and then some individuals who have really powerful stories about how they've, risen to the challenges in front of them and done things to create practical support and resources. And so excited for that session. And then on July 9th, we'll be focusing on changes to preventative medicine and screening. So as people haven't been going to the hospital, that is going to have an impact on screenings and other issues. And so we're going to tackle what that means for people, not only with a diagnosis, but for detecting things earlier and doing more preventative care, and what the impact of healthcare will be for that. And then on July 16th, the session will be about policy and change. And the question is not just how do we get through this pandemic, but how do we learn from, what was the expression? Was it Kelly that said it about don't ever let a crisis go to waste? How do we actually use all of this trauma that we're going through right now to make things better, to make mental health better, to make treatment better? There is real opportunity in all of this struggle. And so we're going to dig into that on July 16th. And then the 10th session on July 23rd, which is a Thursday, is all about the patient voice and how we as individuals can find our voice and use our voice. And that means both for ourselves and for others and for healthcare. And with the new patient-focused drug development and patient-focused medicine development in Europe, there is more opportunity than ever for our voice to be heard and to change healthcare. The most important thing to GRIT and our team at GRIT is helping people find their voice and use their voice. I get goosebumps saying that. And everybody on the panel and the comments in the chat today, to me, were the greatest sort of aspiration of what can happen and how we can feel connected. So I had hoped to do a quick run through of the panel, but I know of the virtual conference, but I know we're over time. So we'll start with that on the next session. Just please know when you come to the Advocacy Exchange, covidadvocacyexchange.com website, you can visit the auditorium. The exhibit area is chock full of organizations with different resources. So please navigate around that. Check out all the things that are in there. There's an information desk to ask questions. And there's a lot in there. So we've got 4 more weeks coming up. We would love your feedback. So please reach out to us anytime. What comes next after these 10 weeks together? We are defining that now, and we co-created this whole thing together, and we'd love to co-create with you after that. Jasmin, may I put you on the spot and just take yourself off mute and have your son take us out.
Hi. Everybody have a good day.
Stop being shy. Say thank you for having us.
Thank you for
He's shy. They can't hear you.
Thank you for having us.
Perfect.
That is the best ending possible. Thank you, everybody. Have a great day, and we'll see you again.